Welcome. This video contains essential information about the pediatric DTaP vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas, and I am a member of the Navajo Nation and a resident physician in family medicine. I am partnering with Native Boost to share this presentation with you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost patient education tools, you can visit www.nativehealthresources.com. Click on the Resources tab and filter resources by the Native Boost campaign. Okay, let's get started. Today we will discuss essential information about tetanus, diphtheria, and pertussis infections, DTaP vaccines, and current DTaP vaccination recommendations for infants and children. I will also share useful talking points you can use when speaking with parents and caregivers. Finally, I will offer some additional resources. So we're going to take a few minutes to discuss tetanus, diphtheria, and pertussis. Diphtheria is caused by Corynebacterium diphtheria, an aerobic bacillus that it itself is infected with a corynebacteriophage carrying the tox gene. The toxin inhibits cellular protein synthesis, causing local tissue destruction and the formation of a pseudomembrane in the pharynx. The toxin also causes manifestations of infection, including myocarditis, nephritis, polyarthropathy, and thrombocytopenia. Non-toxin producing strains can cause severe pharyngitis, endocarditis, bacteremia, cutaneous lesions, and septic arthritis. The incubation period for diphtheria is 2 to 5 days, with the range being 1 to 10 days. Humans are the only reservoir. Transmission primarily occurs via respiratory droplets. However, transmission can occur with close contact with skin and everyday objects like toys, doorknobs, and clothing. Prior to vaccination, greater than 100,000 cases were reported annually in the U.S., with 13,000 to 15,000 deaths. With routine vaccination, which began in the 1940s in the U.S., there was a rapid decline in cases. For instance, from 1996 to 2018, only 14 cases and 1 death were reported. Tetanus is caused by the exotoxin of Clostridium tetani, a spore-forming anaerobic bacteria that resides in the soil and in the intestines of some animals and humans. Spores enter the body through contaminated wounds and germinate under anaerobic conditions. The resulting bacteria then produce an exotoxin, tetanospasmin, or the tetanus toxoid, that interferes with the release of inhibitory neurotransmitters, leading to unopposed muscle contraction. In susceptible individuals, muscle involvement occurs in a descending pattern, usually beginning with trismus or lockjaw and progressing to include neck stiffness, difficulty swallowing, and abdominal rigidity. The incubation period is about 8 days, with the range being 2 to 21 days. Spasms continue for 3 to 4 weeks. Death results from respiratory failure, autonomic dysfunction, including arrhythmias, aspiration pneumonia, and pulmonary embolism. Bordetella pertussis is an aerobic bacteria that produces multiple toxins and antigenic proteins that produce clinical symptoms. These components include pertussis toxin, filamentous hemagglutinin, agglutinogens, adenylate cyclase, pertactin, and tracheocytotoxin. They cause harm through paralyzing cilia, causing inflammation and inhibiting the body's immune response. Notably, immunity occurs from natural infection but is not permanent. The typical incubation period for pertussis is 7 to 10 days, with the range being 4 to 21 days. Humans are the only reservoir. Transmission is from respiratory droplets. 3 stages of pertussis infection include carteral, paroxysmal, and convalescent stages. The first stage, known as the carteral phase, occurs when symptoms are indistinguishable from the common cold. This stage usually lasts 1 to 2 weeks. During the paroxysmal stage, there is worsened cough with typical paroxysms lasting from 1 to 6 weeks. After this period comes the convalescent phase, which is characterized by gradual recovery over weeks to months. Complications of pertussis can include secondary pneumonia and neurologic symptoms, including seizures and encephalopathy, either from hypoxia or direct impacts of the pertussis toxin. Infants are most effective. For instance, of 307 deaths from 2000 to 2017, 84% of deaths were infants less than 2 months of age. Prior to regular vaccination for pertussis in the U.S. in the 1950s, in the U.S., there were about 175,000 cases of pertussis annually. Regular vaccination has had a tremendous impact on disease burden. From 2000 to 2017, pertussis caused, on average, about 2,957 infections, 1,122 hospitalizations, and about 15 deaths annually in the U.S. Significantly waning immunity among adolescents creates the potential for asymptomatic reservoir hosts. Now we're going to take a moment to discuss the ins and outs of the DTaP vaccines. Today, there are 6 DTaP vaccines available in the U.S. 2 contain only DTaP and 4 have DTaP in combination with other vaccines. The 2 standalone vaccines are Daptocil and Inferrix. Both Inferrix and Daptocil contain aluminum as an adjuvant. Neither contains antibiotics, preservatives, or latex. The 4 vaccines with DTaP in combination with other vaccines offer the advantage of receiving fewer injections to complete the primary series of childhood vaccinations. Each of these vaccine combinations contains one of the 2 versions of DTaP vaccine plus 1 or more additional vaccines in combination. No randomized controlled trials have ever been conducted with either tetanus toxoid or diphtheria toxoid vaccines alone. Instead, effectiveness has been inferred by reduced disease and fatality from these diseases following the routine use of the vaccines and by demonstrating a protective antitoxin seroresponse, meeting agreed upon levels for immunity. It's important to note that earlier pertussis vaccines contained whole cell inactivated pertussis antigen. This was replaced in the late 1990s with acellular pertussis antigens. Acellular pertussis vaccines have a better safety profile. However, the immune response appears to wane faster. 1 month after receiving 3 doses of Inferrix at ages 2, 4, and 6 months, greater than 83% of children had at least a 4-fold antibody response to the 3 pertussis antigens. PT, FHA, and PRN. 1 month after receiving 3 doses of Inferrix at ages 2, 4, and 6 months, greater than 83% of children had at least a 4-fold antibody response to the 3 pertussis antigens. All children also developed diphtheria antitoxin titers and tetanus antitoxin titers, indicating immunity. Furthermore, greater than 80% of children aged 15 to 20 months had at least a 4-fold rise in serum antibody to each pertussis antigen after a 4th dose. Together, these findings demonstrate that a strong immune response can be achieved when multiple vaccines are given in a single dose. They also support the need for multiple doses in the first year of life to maintain immunity as the immune system matures. An example of the science behind the current recommended vaccine schedule. The U.S. Daptocil study measured seroresponses in 1,099 children after receiving the 3rd dose of vaccine. Protective diphtheria antitoxin levels were achieved by 98.5% of children, and 100% of children achieved protective tetanus antitoxin levels. Swedish Daptocil study randomized controlled trial with 9,829 infants comparing 3 doses of Daptocil with 4 other diphtheria tetanus-containing vaccines. Efficacy of 3 doses against pertussis was 85% after up to 2 years of follow-up. Systemic side effects are more common with the first 3 doses. These include fever, 6 to 16%, lethargy, 21 to 51%, inconsolable crying, 14 to 59%, and fussiness or irritability, 35 to 76%. Data shown here are for U.S. pre-licensure study of Daptocil. However, data for Inferrix is similar to that of Daptocil. Local side effects for both vaccines are more common with the 4th and 5th doses. These include injection site pain, 62%, redness, 36%, or swelling, 24%. Ongoing surveillance has found no association between DTaP and specific rare neurologic events, including encephalopathy, encephalitis, meningitis, paralytic syndromes, seizures, cranial nerve disorders, or Guillain-Barré syndrome. As described earlier, there are currently 4 vaccines in which DTaP has been combined with other vaccines. These vaccines have also been assessed for safety and efficacy in trials leading to licensure. The safety of combination vaccines has not identified any additional risk compared to DTaP alone. Also, the seroresponse to antigens contained in combination vaccines have been found to be at least as high or higher than response seen in DTaP only vaccines. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated based on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccines Adverse Events Reporting System, or VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendations published in the CDC immunization schedule. ACIP is a group of clinicians, researchers, public health experts, and at least one unaffiliated community member that meet at least 3 times per year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. When it comes to DTaP vaccine, the CDC immunization schedule recommends a 5-dose series. This includes a 3-dose primary series administered at ages 2, 4, and 6 months, followed by booster doses at ages 15 to 18 months and 4 to 6 years. Prospectively, dose 4 may be administered as early as age 12 months if at least 6 months have elapsed since dose 3. Retrospectively, a 4th dose that was inadvertently administered as early as age 12 months may be counted if at least 4 months have elapsed since dose 3. There are 2 contraindications for use of DTaP vaccines: severe allergic reaction to vaccine components or following a prior dose, and encephalopathy not attributed to another identifiable cause within 7 days after vaccination is a contraindication specific to the pertussis component of the DTaP vaccine. The following are listed precautions for use of DTaP vaccine: moderate or severe acute illness, progressive neurologic disorder, including infantile spasms, uncontrolled epilepsy, progressive encephalopathy. In this case, defer DTaP until neurologic status is clarified and stabilized. Another precaution is Guillain-Barré syndrome within 6 weeks after a previous dose of tetanus toxoid containing vaccine, and a history of arthus-type hypersensitivity reaction after a previous dose of diphtheria toxoid or tetanus toxoid containing vaccine. In this case, defer further vaccination until 10 years after last tetanus toxoid containing vaccination. For children younger than age 7 years with a contraindication specific to the pertussis component of DTaP, providers may administer TD for all recommended remaining doses in place of DTaP. Note that encephalopathy within 7 days of vaccination, when not attributed to another identifiable cause, is the only contraindication specific to the pertussis component of DTaP. For additional information, see About Young Children with a Contraindication to Pertussis-Containing Vaccines, Whooping Cough, CDC. Wound management in children younger than 7 years with a history of receiving 3 or more doses of tetanus toxoid-containing vaccine includes: for all wounds except clean and minor wounds, administer DTaP if more than 5 years since last dose of tetanus toxoid-containing vaccine. For detailed information, see the CDC website. You may have thought during this section of vaccine recommendations, wow, this is getting a little complicated. If only there was an app for that. Well, there is. The CDC Vaccine Schedules app is a great resource for DTaP and other vaccine recommendation. It is available for download for free for both iPhone and Android phones. The app is continuously updated with the latest immunization schedules for children and adults. It also includes catch-up schedules for people who may be under-immunized, as well as the most recent information on vaccine precautions and contraindications. To recap, thus far we have discussed tetanus, diphtheria, and pertussis, and DTaP vaccines, as well as current vaccine recommendations for infants and children. Now we will discuss strategies for talking with parents and caregivers about DTaP vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke with over 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal community members from across the region. Through speaking with community members, we learn that they want to learn the basics about what the diseases are and why vaccines are important via face-to-face conversations with trusted medical providers. Thus, when educating parents and caregivers about the DTaP vaccine, it is important to take time to discuss what tetanus, diphtheria, and pertussis are, as well as the potential consequences of not vaccinating against them. Something to keep in mind when speaking with Native patients is that it is vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making the providers feel like they were being challenged, parents and caregivers commonly said that they avoided asking questions about concepts or words that they did not understand. So, as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information to your patients. When it comes to speaking with your patients about tetanus, diphtheria, and pertussis infection and the potential consequences of not vaccinating against them, consider saying something like this. Diphtheria, tetanus, and pertussis are all serious diseases. Diphtheria can damage kids' hearts and nerves. Tetanus can cause painful muscle spasm. When spasms get to the neck and chest, kids have trouble breathing. Pertussis can cause such bad bouts of coughing that children can choke. In severe cases, diphtheria, tetanus, and pertussis can kill. Thankfully, there are vaccines that can help protect everyone starting at 2 months. Then consider letting parents and caregivers know just how effective DTaP vaccines are by saying something like, I let all my patients know that DTaP vaccines are effective. Most children who are fully vaccinated will be protected in childhood. And if your child gets vaccinated and then happens to get sick, which is unlikely, their illness will probably be mild. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about DTaP vaccine safety, make sure to let them know that since diphtheria, tetanus, and pertussis can all result in serious health issues, like trouble breathing, we have been regularly vaccinating kids in the U.S. against these infections since the 1990s. Since the DTaP vaccine was approved, millions of Americans have safely received the vaccine, including American Indians and Alaskan Natives. Make sure to remind your patients that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind that serious reactions to vaccines, like the DTaP vaccine, are extremely rare. You're more likely to get hit by lightning than have a severe allergic reaction to any shot. Based on Native Boost research, it's also important to normalize mild vaccine side effects. Make sure to emphasize that after receiving the DTaP vaccine, like any vaccine, children may experience mild side effects. Consider say something like, when it comes to the DTaP vaccine, common side effects may include fever or pain, redness or swelling where they got the shot. Mild side effects are a good sign that your child's body is preparing to fight diphtheria, tetanus, and pertussis. Within our bodies, each of us has warrior cells, also called antibodies, that stand guard and attack disease. Vaccines like the DTaP vaccine help our warrior cells see and fight disease. For example, when we get the DTaP shot, the ingredients in the shot tell our warrior cells how to recognize and fight against diphtheria, tetanus, and pertussis. Sometimes, when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not signs of illness. They are a sign your child's body is getting prepared if needed to fight diphtheria, tetanus, and pertussis in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize, thus far we have discussed the importance of educating parents and caregivers about the basics of diphtheria, tetanus, and pertussis, as well as the potential consequences of not vaccinating against them. Based on our research, we emphasize the need to use clear and concise language, void of medical and scientific jargon. We also offered language that can be used when discussing DTaP vaccine effectiveness and safety, and the need to normalize the experience of mild vaccine side effects. Now we will discuss strategies for sharing culturally resonant messages with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated when asked about effective messaging around vaccination. Tribal community members commonly express a desire for providers to emphasize the benefits of vaccination from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers of their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. Also, medical providers, it's critical to listen to patients' concerns, take time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and their family. To enhance your knowledge about tetanus, diphtheria, and pertussis and other vaccine preventable diseases, there are a few resources I'd like to share. One is the Epidemiology and Prevention of Vaccine Preventable Diseases, also known as the CDC's Pink Book. This comprehensive manual provides detailed information about vaccine preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been changes made to the schedule. To ensure you have the most up-to-date information, make sure you check out the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedules app. Finally, if you would like to access culturally resonant patient education materials offered by Native booths, visit www.nativehealthresources.com. Also, check out www.indiancountryecho.org/booths for additional training for medical providers working at IHS, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together, we can increase the number of Native kids who are protected against tetanus, diphtheria, and pertussis, and other childhood illnesses. Additional resources are shown here. Click on any of the links to learn more. Thank you for watching this presentation. We hope this information will help you encourage your patients to receive all of their recommended vaccines on time. Together, we can save lives every day through vaccination.